Hey everybody. Hope everyone's off to a good Tuesday or closing out a great Tuesday. We're basically middle of the day here in El Paso, where it's a little after 4:30 Mountain Standard Time, and a beautiful, gorgeous day here. It was really windy the last few days, got kind of chilly yesterday, but today is a glorious day to be outside. And while I'm with you on Instagram Live, Amy is out in the Franklin Mountains enjoying nature and hopefully bringing back some good stories of her adventure and maybe some pictures that she's taken that we can share later. But I hope everyone is safe. I hope everyone is healthy. I hope everyone's being good to yourself, to those that you live with and others in your life, and that you do your best to check on those who need your help right now. Relatives who are older, unable to leave the home, those with underlying conditions that should prevent them from leaving the home. Check on them and see if you can't pick them up some groceries, or just make sure that they're okay, or that they know that you love them and that you're thinking about them. That's something good that we can all do right now. Also, our thanks to everyone who did not tune in to the President's press conference, and all members of the press who did not carry that press conference live. Since we cannot trust what the President says, it's really important that journalists and people have time to verify the information, correct lies or misstatements made by the President, and in the middle of this pandemic, share the truth with the American people. And so we're grateful for that. We're going to have a wonderful guest on today. Dr. Laila Woc-Colburn is in Houston, Texas with Baylor Hospital and the Harris Health System. And we want to get her perspective as someone who works on infectious diseases and in epidemiology about what this looks like in Southeast Texas, what it means for our state, answer your questions about what you should be looking for, what you need to do, how even you might be able to treat some of the symptoms in your home, short of going to the hospital. We had Dr. Gilman on yesterday, an emergency room physician, who cautioned us, even if we believe we have COVID-19, not to go to the emergency room unless we have to, because so many of these ERs, so many of these hospitals are becoming overwhelmed right now. So we might get Dr. Laila Woc-Colburn's advice on some of these issues. But I talked about making sure that we traffic in the facts and in the truth. And I want to share with you what we know right now. This is the latest information I have. In the United States, we have 183,532 cases as of Tuesday afternoon, with 3,860 of our fellow Americans having passed away from COVID-19. Now, I want to say in total cases, over 183,000, and total deaths over 3,800. Every expert that I've listened to tells me these are gross underestimates because we have underreporting right now. We don't have the tests to know who does and who does not have COVID-19 in the United States. And as we learned yesterday, even when someone dies from COVID-19, and has been tested, there is a delay in being able to report that, or sometimes a breakdown entirely in being able to get that through. We talked to a doctor who spent an hour on the phone trying to share with, I guess, the Centers for Disease Control or whoever they report to about a patient who lost their battle with COVID-19. So these are at best estimates or indications of the trajectory that this pandemic is taking. It should by no means tell us precisely how many people have COVID-19 or how many people have died. It is much, much higher. And we don't know if the factor is of 2 or 5 or 10, but it's certainly greater than the numbers that I've just shared with you. Likewise, keep that caveat in mind when I share with you the numbers from Texas. This comes from the Department of State Health Services here in Texas. 122 of the 254 counties of Texas are reporting cases of COVID-19. Total cases in Texas reported 3,266. Total fatalities in Texas reported 41. So again, that number of 3,200 plus cases and 41 fatalities in Texas, that's only an indication and is only really important relative to the numbers that we got yesterday and the day before to understand the trajectory that this pandemic is on in Texas. We know, because there's been such little testing in Texas, that the numbers have to be much greater than this. Tests administered in the entire United States. Now, this is a country of 327 million people in the midst of the greatest pandemic that we've seen in the last century, in the last 100 years. Only 103,945 tests have been administered. So almost 104,000 tests in a country of almost 330 million people, which begs the question that should have been asked at the press conference today, and I hope it was: where are the tests that we have been promised for the United States? Where are the tests that we need here in Texas so that those in positions of public trust can make informed decisions, so that we can begin the process of contact tracing, so that we can isolate those who are infected, understand everyone that they've been in touch with, so that we stop the spread of this pandemic? Where are the tests? Question number one. Question number two, having spoken to and listened to so many healthcare professionals on the front lines of this pandemic, where are the masks and the gloves and the visors and the gowns and the other personal protective equipment, or PPE, that we so badly need, which the president accused healthcare workers of stealing? For what purpose, I don't know. But which in reality are in desperate need in so many of these hospitals, where they're being rationed and in some cases being replaced with makeshift creations from doctors and nurses, like garbage bags or patient gowns, which don't cover the doctor or the nurse sufficient to protect themselves and their fellow patients. Last question, after tests and PPE, where are the ventilators? Those governors in the states hardest hit, like Governor Cuomo in New York, say that they need ventilators, that they're bidding against every other state in the union in an eBay-like system for these ventilators. So they're working at cross purposes. If you ever needed federal intervention and federal leadership and a president who can manage a crisis, it is at this moment. Failing that, and so far our president has failed us in that, then we need these governors to be able to come together and hopefully negotiate distribution of these ventilators on their own. And then all of us need to do our part in pressuring those who are in these positions of power and public trust to do the right thing. And last thing that I'll say before we bring our guest on for 15 or 20 minutes, however much time she can spare with us to answer your questions. All of us on this Instagram Live have been urging Governor Abbott in Texas to issue a mandatory shelter-in-place order. We've asked you to call his hotline, and so many of you called today that I think the switchboard literally shut down. You were no longer able to get to somebody or to leave a message. Thank you for doing that. Others of you took it upon yourselves to send an email or to fill out their contact form on the governor's website. I think that pressure over the last days and weeks, the contrast in leadership offered by people like Dallas County Judge Clay Jenkins, has finally forced the governor to act. And at 2 o'clock today, Central Standard Time in Austin, Texas, the governor announced something close to a shelter-in-place order for the state of Texas, though he refused to call it that, which invites some confusion, some suspicion, and some misunderstanding of what's taking place. But essentially, I think what the governor's saying, and what public health experts have implored us to do, is to not leave your house unless you absolutely need to, unless you have an essential job. You're a police officer, you're a healthcare worker, you work at a grocery store, you help to run a food bank, jobs like those. Otherwise, stay at home, shelter in place, and don't leave if you are running any risk of coming into contact with anyone else. So if you want to walk your dog and you're not going to come within 6 feet of anybody else, go do that. If, like Amy, you're walking in the mountains right now, again, not coming within 6 feet of contact of anyone else, go do that. Otherwise, or go pick up some groceries or deliver them for your mom or dad or grandparents or that older person in your neighborhood. But do not touch anyone. Do not congregate with other people. Stay in your homes. One, it keeps you safe. Two, it keeps the people in your life safe. You may be young and healthy and seemingly invincible, but you could unwittingly carry coronavirus into the home of your parents or grandparents or into your friend's home, who will then pass it on to their parents or grandparents. So if you care about the people in your life or in the lives of your friends and your family members, you're going to stay at home. And second, we don't want to put additional pressure on those courageous, extraordinary, brave, all-time heroic healthcare workers who are on the front lines of this right now. So give them a break by helping to reduce the spread of coronavirus by staying home. I have a good friend who, when she was sending out her holiday greetings a couple of years ago, she said, the world is a narrow bridge, and the important thing is not to be afraid. Now, this is something that many of you have heard many times before. It's not a new saying or a new piece of advice, but never more resonant for me or more poignant than at this moment, that the world is a narrow bridge, and the important thing is not to be afraid. Be smart, be kind, be empathetic, be thoughtful, be courageous. Don't be afraid. Don't give in to panic. Be good, be kind, and be smart. And I thought about that when I heard from that same friend's family who had learned that their mother had died. They were flying back from Europe to attend the funeral, learned that half of the flight had been in countries like Spain and Italy, where coronavirus was spreading very quickly. And when they were coming through customs in the United States, those people who had been in those countries, who were given a special white form to fill out, were in the same line as everyone else coming into the United States. This was in, I think, the first or second week of March. That person comes home. Turns out they have coronavirus, from which they recovered, but their wife has coronavirus, COVID-19, is now in the hospital, in isolation, is too weak to be able to pick up the phone, so they have no means of communicating with her, cannot visit with her right now. That same person tells me that his father, who's 90 years old, who he visits every day by going to his home and waving to him outside of his window, he's afraid that his father is exhibiting those same symptoms right now. To him, to everyone else in this country, everyone who's watching this right now, who has a family member who is battling against COVID-19 right now and cannot be with that family member, we are sending you our strength, our love, our power, and we're reminding you not to be afraid at this moment and to take courage and solace in all of us who are with you right now at this trying moment. All of us have to come together. All of us have to see this through. So just wanted to share that message with you. I'm going to now introduce Dr. Laila Woc-Colburn. And let me read an introduction to you so you know who we're about to hear from and so that you can prepare your questions. There's a little question icon at the bottom of your screen right there. And if you click on it, you can pose a question, and then I will ask that of Dr. Woc-Colburn. Recruited to Baylor College of Medicine by the section of infectious disease to start the HIV/AIDS transition service at Ben Taub Hospital. Started the first tropical medicine clinic at that same hospital and in the Harris Health System to prevent, diagnose, and treat common and neglected tropical diseases in the Houston metro area. Has received 2 prestigious awards, the Rising Star Clinical Award and the Rose Norton Fulbright Award in teaching and evaluation. Her passion is to educate the next generation in the art of medicine and infectious diseases. So I hope that you will help me welcome her by asking a question in the little question button. I will push this other button to see if I can get her on right now. And Miss Kano, I don't see her on there. We're looking for Dr. Woc-Colburn, and let me make sure. Sorry about that. Miss Kano, can you reach out to her and see if she's still on the stream? In the meantime, let me bring up some of your questions, and maybe there's some that I can help to answer. Yeah, a lot of great questions coming in for Dr. Woc-Colburn. Hopefully Kano's watching this too and is getting in touch. There's questions about an update on a cure or a vaccine. Here's someone who asks, are you quarantined in your dungeon gulag? I am spending a lot of time in the basement where I've got my camping gear, and where there's some peace and quiet from the kids who are upstairs homeschooling and sometimes making a lot of noise. Hold on a second. I may have an answer from Kano. All right. Doc, I'm looking for you. Hold on one sec. I'm going to figure this out. I'm slow, but I'll eventually get it. No, I don't have anyone on by that name, Kano. So I've got requests from a few people, none of whom are that doctor. Son of a gun. Let's see. Here we go. All right, it says that we're about to connect with Dr. Woc-Colburn. Hopefully this works. Hey!
Hi.
There we are. Sorry about the delay.
That is okay.
User error on my part.
That's all right.
Thank you for joining us.
You are welcome. How can I help you today?
So tell me how things look in Houston right now. What are you seeing?
So right now I'm here at one of the hospitals that Baylor College of Medicine staffs, and we're starting to see a surge of patients that in the Texas Medical Center. We have some patients that we're ruling out and other patients that are in our general wards, in isolation units, and we have other patients that are in the intensive care units. So a little mix.
We're staging a sick out to protest.
What kind of hospital capacity challenges are you seeing, if any, so far?
So, you know, right now I participate in different committees to look at that. And what we're seeing right now is our PPE, you know, so we're implementing areas where we are rationing our PPE in wait for the surge.
And what does that mean? So, for example, is someone unable to use PPE now that would have otherwise been able to use it before, or are you using it differently? What does it mean to ration it or be conscious of the amount of PPE that you have?
So what we're doing is we're following the CDC guidelines to ration our PPE. So it means that we usually go into a patient's room and that have, like, for example, MRSA or VRE, which are, you know, infections that can be transmitted, not using those times because we do know that they transmit less. And so that saves us gowns as well as masks and as well as gloves.
And how would you judge Harris County's response? And I'm not talking about the county judge or political leaders. When you're on the street, when you drive by a park, when you go into the grocery store, how closely are people heeding the public health advice not to congregate, not to leave the house, not to be with one another?
So I definitely seen less people in the streets. I mean, my commute is much better. There's actually no more traffic between my house and the hospital, so I actually can make it there. I do see, you know, I mean, a lot of our restaurants and places have closed and they have only for takeout. So less congregations. I'm a runner, so I usually run in the mornings. On the weekends, I probably saw a little bit more people. They're trying to keep their distance as much as possible.
And do you have an idea of how many reported cases of COVID-19 you have in Harris County or Houston?
I think this morning I would have to look at the Houston Chronicle. They actually keep up a running mate of how many people are having there. And of course, the numbers that you see there are not our true numbers because we're only testing patients that have the most severe symptoms.
Let me ask you this. We don't have enough tests to test everyone who wants one, and probably don't have enough tests to test everyone who should be tested. Do you have any idea of what the scope of this is in Texas? The numbers sound really low. We read them off at the beginning. There are only 3,266 cases in a state of nearly 30 million people and 41 fatalities so far. One fatality is too many, and 41 is a lot. But from talking to and listening to an ER doctor in New York City yesterday, he feels like there is gross underreporting, and the failure in providing testing means we don't have a good idea. Any light that you can shed on that?
So first of all, we're about probably 2 or 3 weeks behind what New York is seeing. Our cases came later, so by the time New York was starting to peak on the roller coaster, we started to see our first imported cases. Now we have community spread because now they're not related to people that have traveled outside the state. So we're hoping, there's different mathematical models that are, saying that we're going to peak over the next 2 to 4 weeks. So we're at the beginning. We're kind of in the middle of that roller coaster to go. What we don't want is to peak at the top of the roller coaster and have what happened in New York. So testing is important because if we test, we can isolate. We isolate the symptomatic cases, the one that can transmit the virus, and it's easier to isolate, 4 people that are going to transmit it to 8 to 16 than to isolate 100 people who are going to transmit it to 1,000 to 10,000, because it actually goes up in a logarithmic scale.
It's helpful to hear you say that in terms of understanding why it's important for us to shelter in place and not to congregate, and how we, the phrase flatten the curve has been used so much, but it makes a lot of sense. You don't want this to peak in a way that overwhelms capacity at our hospitals and the ability for doctors to be able to treat those patients. And you don't want to get to a point where physicians and frontline medical teams are having to make decisions on who they're going to treat and who they're not going to treat because of limited resources and capacity. So if anyone's concerned about that becoming the situation, best thing for you to do is to stay home, not congregate, and isolate yourselves from other people physically. If you don't mind, I'm going to take a few questions from the folks who are watching. Here's a question that I don't know if you have the information to, or if anyone does. What are we seeing in terms of rates of recovery, and how long does it take someone to recover? If someone, and I don't know if you have this information, but if someone is placed on a ventilator, which I assume is more the extreme end of the spectrum of these cases, what is their prognosis for recovery?
So it's a triple question. So when you get infected, we talk about 80, 15, 5. So 80% will recover well. You'll get a mild disease and you'll recover. We're not so much worried, but they can actually transmit those. Then you have that 20% that is the one that we worry that ends up in the hospital. We're seeing that there's a wide range of ages. It's not only the people who are above the age of 65, but we're also seeing younger people. And so if you get the mild disease, you will recover, your test will be positive, and then about 14 to 21 days, the test will become negative. What we hope as you recover is that your body makes these antibodies. They're little soldiers that remember the disease so you don't get reinfected. The other 20% that, the 15 and 5, is the people that might end up in an intensive care unit. And those are the ones we worry because their recovery can be a long time. Once you are over the disease, what you're left with your lungs are very damaged lungs. And those are the ones that we need the ventilators. And people can stay on ventilators for many months. So let's talk just a patient without COVID or anything, someone that has this ARDS. Patients can be, can have a couple of months on a respirator, they get a tracheostomy and they go, but their lungs never recover quite completely. Other patients that really need a lot of ventilations end up in something called an ECMO, which is a machine that lets you breathe and it makes your lungs recover slowly because you have scar tissue.
You mentioned the antibodies that are produced. Talk to us about what you're seeing in terms of cures or vaccines. I read a story, I don't know that I fully understood it, about using blood, maybe this is an experimental treatment, using the blood from those patients who recovered from COVID-19 because of the antibodies that it has, and perhaps transfusing that to patients who have been unable to recover. I might have that completely wrong. Correct me and tell me what hope there is out there based on this kind of experimental treatment or other things that give you some hope or give us some promise that we're going to get through this.
So right now we don't have any treatment. Everything is being studied. So the two things that we're studying is a therapeutic, which is a treatment, and a vaccine. The treatments, there is a lot of things going out on Facebook, the social media, because everybody's looking for a cure. So one of them is something that we've done many, many years ago. It's called Convalescent Plasma. We used to get this from horses. For people who infected their horses, we get their antibodies and they inject into someone, which is actually, you get some other side effects. So, for example, there's hospitals here in the Texas Medical Center that have looked at doing the plasma convalescent. There are clinical trials. There's one ongoing in New York, one ongoing with Hopkins, to look at this. The idea is that you inject this. It's just like a blood transfusion. It helps your immune system say, we have little soldiers to fight the infection. We want to do that at the early stages of disease, not when you're already on a ventilator day 21 and you're going to ECMO, because that might be too late. We want to hit it at the beginning where your body still can fight that. And you're not debilitated because you've been in an intensive care unit for 2 or 3 weeks.
Doctor, while I look for the next question from our viewers, can you address something? I saw you on a local news piece in Houston, Texas, talking about acetaminophen and ibuprofen and when it's appropriate to use either in relation to those who may think that they have COVID-19.
Yes, so at the beginning of, so one of the things we're learning about COVID-19 in our experience of 4 or 5 months is that every week, it's like drinking from a fire hose. We get a lot of information. So one of the things, and this comes from Dr. David Aronoff, as he's the chief of ID at Vanderbilt, and he studies the use of ibuprofen in infections, is that we know that when someone is sick, you might overuse the ibuprofen, and that might actually damage your kidneys and have other things. I know that the FDA came with comments saying it was okay, but we prefer to use acetaminophen, no more than 2 grams, just for your fever. That's what you need it for. And so that causes less damage. There's a lot of techniques out there, but, keeping it simple, hydrating yourself, taking your Tylenol, and, eating, and, that should do fine.
Let me ask 3 quick questions to viewers. The first one, what are your thoughts on masks for all? The case that I've heard for this is that in China and in other Asian countries, there is no distinction between those who have a respiratory illness and those who do not. So there's no shame. And so people are more likely when they should be wearing a mask to actually wear one because they don't stand out. Do you agree? Do we have enough masks to even contemplate doing this? How would you answer that question?
So, one reason, it's a cultural part. So in Asia, it is not unlikely that someone uses a mask. One, because of pollution, and two, out of respect that if you have an illness and you're coughing, you don't want to transmit this because you're in a highly populated area. In our countries around, we are not used to seeing people on masks. But also wearing the mask is, if I cough into the mask, and that stops the spread. It's like putting a little barrier, right? But you have to know how to use the mask. I mean, I've seen it that people don't cover their nose, so you have to cover your nose if you don't dare. But the mask also can give you a false sense, because if you touch the front of the mask and it's wet and you handshake someone, you might transmit that. So, but at the same time, you have to be cautious. It's the same thing people wearing gloves. You can wear a glove and you feel protected, but if that glove is touching everything around and you don't take it off or you don't wash your hands, then you can actually transmit it too. Now, is there enough masks? That is always a question. I mean, we have, if you go to Amazon or you try to order masks right now, they're out of stock, right? So what we had said at the beginning when this started is to be aware that all the first responders, the healthcare workers, we use them because we're in a highly environment that has a lot of things going on, like if the viruses, if I go to one of the units, it's going to have more virus than if I go outside. So just be diligent about it. If you are, if you have immunosuppressed or your immune system is not as good or you're debilitated because of chronic disease, it's okay to use it, but cover your nose, be careful not to touch the front, and always wash your hands.
Great. Here's another question. Is there a risk for reinfection regarding COVID-19?
So the likelihood of reinfection is very small because we build these antibodies. We know that between 14 days to 28 days, we'll have fully antibodies. Once you have those, you are less, you're not going to get it. Now, how long does those antibodies last? That's that is the basis of building a vaccine. That's how the plasma works. It's a momentary time. And when we build the vaccine, it's the same thing. We are making your immune system make this antibody so you don't get sick.
Great. And then this will be the last question I take from a viewer. I know that you have to go soon. So the question is, do you think this will be over by July? And maybe the spirit of the question is, how do you think this ends? What does this look like over the next 12 months? We were talking to Andy Slavitt the other day, who talked about 4 phases of this, with the last one being a vaccine and treatment for those who have COVID-19. Do you want to venture any kind of a time frame or timelines, or what we should expect, and what might give you some hope that we're going to get through this? I think that's something we all need.
So right now we're a naive population. We're like a virgin population. We've never seen this virus. We will probably peak, but this is a coronavirus, and we know from virologists like Dr. Akiko in Yale that it's a seasonal one. So we'll see it more during winter, less during the summer, and there's a lot of reasons why. So this can go like the flu, where we have a peak in December, January, and February, and then comes down and then come back again. That's the reason for developing a vaccine. Will it be over in July? We certainly hope so, but one of the things that works is when you stay at home. And I know it's very difficult because people have to work, we have an economy and everything, but one of the reasons is that way we can actually see how this works the best. For example, San Francisco has a stay shelter, and they've seen in University of San Francisco a very small upsurge, and they are able to take care not just of the COVID patients, but other patients that might need it because they're also sick.
And this will, I promise you, be the last question and a quick one, but I want to ask it on behalf of another population that's on the front lines, food and grocery and restaurant workers. Possibly Hipster asks, I work at a restaurant, what precautions should I be taking? Obviously washing their hands, but talk about the surfaces that they're touching, what disinfectants they should be using, what they should do in those kinds of essential jobs where you still have to be around other people.
So same thing I do every day over here. I wash my hands with soap and water, or use the sanitizers with alcohol. I know that some distilleries in Texas are doing hand sanitizers, so that's going to be helpful. Also, it's, cover your mouth, when you cough. Try to disinfect the surfaces you're around, because this kind of stays on the surfaces. So are the same things I tell my nurses, the same things I do every day. Is it very simple? To wash your hands, keep 6 feet apart, and disinfect the surfaces.
Wonderful. Thank you for what you are doing. And through you, we want to thank all healthcare workers and all public health advocates who are making sure that we do the right thing at this critically important moment. We're so grateful that you took a half hour out of your day to answer our questions, and I hope make us a little bit smarter and a little bit safer. Please be safe, and we hope we get a chance to thank you in person when we can again travel back down to Houston.
Well, thank you for having me over, Beto. And I saw one of the questions, how can you help our healthcare workers? Is by staying home. We're working for you. We can stay home. Some of us have to be away from our families so we don't get them infected. So if we want to win this, we're all in together.
That's right. Thank you again. We're very grateful. Bye-bye.
Bye-bye.
Okay, again, that was Dr. Laila Woc-Colburn. She's in Houston with the Baylor Health System, and made me a little bit smarter. I don't know about you, but I'm grateful that she answered our questions, and really, really grateful for what she and other healthcare workers are doing all over this country. So want to thank her for being on. Send us suggestions for who you would like to hear from, what will make you smarter, who you'd like to be able to ask questions of, and then we'll do our best to get them on. One, this is a way for me to connect with you and others at a time that we're otherwise isolated, so I enjoy this. It's a way for me to get smarter on this, the most important issue that's facing this country right now, and I appreciate it from that standpoint. But I want to make sure that this is good for you as well. So please let us know. All suggestions, especially all complaints, send to Cynthia Cano. She would be happy to take them. And I think we are going to have Jim Ward on sometime this week. In fact, I'm going to try to get Cynthia on so she can tell us. Cano, where are you? And if Cynthia can join us, she can tell us who we're going to have on later this week. I watched a really interesting race this weekend. My friend Jay Clayberg in Austin, Texas, ran a 30-kilometer race. But because we're in the moment of social and physical distancing, he had to run that race on his own and then I guess report back his time. It's a training run for the Leadville 50, but he Instagram lived his part of the race, and then he split screened it with his running coach. Really interesting. So much innovation and ingenuity born of this moment. And if you've got great people like that you want to have on, I thought maybe we'd have Jay on, and maybe he could talk to us about what it's like to get ready to run this 50K race and what that means to training. Connor, when do we have Jim Ward on?
Thursday. So
Jim Ward of Sparta, of Sleeper Car, of At the Drive-In, of just being Jim Ward, of Eloise, which is a fantastic restaurant on the west side that he and Christine own and run. I thought it might be fun to just to see him because he's just such a great guy to talk to and so interesting to hear from. But then I also thought he offers us this perspective of a musician, a touring musician who's now unable to tour, who just released an album. So how does he support that album? How does he get the music out there? What does he do when he's got to shelter in place like all of us? So that's Thursday. Okay. And who do we have for tomorrow?
Tomorrow we have Gina and her daughter Summer.
Oh, great. Gina and Summer from Las Vegas.
That's right. Yeah.
Okay. Gina reached out to me and she said, we met Gina when we were on the campaign trail in Las Vegas, and just really impressed me in terms of some of the struggles she has in her life, how devoted she is to her daughter who has disabilities, and for whom she cares. The number of jobs she's working, I think she's working 4 jobs when I met her. And at the time she was homeless or living in her car, but didn't have a home that she could go to or an apartment that she could live in. She just literally couldn't afford one. And she reached out to me the day before yesterday and said, Beto, I'm worried about you. I want you to go get tested. And so we got back in touch with each other, and I said, I'd love to hear how you're doing. I'd love to share your story with those who tune in to this Instagram Live. So Gina is tomorrow. Jim is on Thursday. How about Friday?
I'm waiting for,
come on, Kano.
I know, I'm sorry, but I need to look for somebody. And so if you guys have recommendations, which they do, and they send me a message, so you can, that's why you can get in touch with me. I'm Kano, and you guys can see it right there. So send me your messages and your suggestions, and then I will do my best to try to get them on. I was so impressed listening right now to the doctor. She was amazing. It really, really, I think a lot of us have a lot of questions, and so it was very helpful to me to hear her talk about the best practices.
Hey, Kano, there's somebody with the screen name Grape Station, and they say they need help and that they're sick. Do you mind following up with them?
I will. Send me a message.
It's hard to tell through the comments.
Right now, I'll make a comment, and so I'll go back. I'll look.
Okay. Yeah.
Do my best.
So yeah, hard to tell what's going on through the comments, but want to take that seriously. Here's a great
and then I got to tell you after them.
Sorry, Cynthia, you go first. Sorry, I interrupted you.
Oh, I'm so sorry. But
don't let me get in the way.
No. I'll be real quick, and then I'll give it back to you. So some folks were telling me that they really, I think on the weekends, maybe if you might have some time, it might be good to see you cook. I think a live stream of you making one of the lemon chicken that you talked about. I read that in an article today. Maybe it would be good to see you make something. I would enjoy that. Suggestion, just a suggestion.
Yeah. Noted. Somebody suggested that we get somebody on from Texas Workforce Commission. They said they've been trying to get help through the website and it's not working for them. And I thought about Laila Melendez here in El Paso, who I think has been very involved with the El Paso Workforce Commission, and maybe just get an idea of the volume of unemployment claims, what in this new $2 trillion relief bill will help those who are filing for unemployment or who do not have work right now. So maybe we can get Laila on Friday.
That's a great suggestion. I will work on that. And I will go back and read some of these because I know there's some really good suggestions about people that we can have on.
Saint Stacy reminds you to stop touching your face. And I thought about that when we were listening to the doctor just now. And she said, even if you have a mask, but you touch your mask and your mask is wet because you've sneezed or coughed in it or just worn it for too long, that'll spread the virus as well. So you keep touching your face.
Okay, that's it. Can I ask a question?
But it's just a best practice because you may be out in public again before long, or you may touch your face, then touch a letter that you're going to put in the mail. Then the mailman touches that. Then he has what you have. So wash your hands and then don't touch your face again.
Okay, got it. And I have it here handy. I keep it before I go out and as soon as I come back, and I do not touch. But look, I'm dripping of Purell.
There you go. Okay, last thing maybe. Somebody asked what can you do? So someone asked, how do you help healthcare workers? And the good doctor said, well, you stay at home so that you don't create additional need and stress out the capacity in our hospitals and in our clinics. And I thought that was good advice. Someone asked how they can help or volunteer safely. And I'll just put a plug in for your local food bank. If it's anything like our local food bank in El Paso, they're seeing unprecedented demand for food and nutrition and calories for the food insecure population that already existed, more than 200,000 in El Paso before COVID-19, and now an unprecedented demand because people have been let go from their jobs, are unable to afford food, may have gone from a 2-income family to a 1-income family to a no-income family, and they need that help. And there was a line in El Paso 2 miles long last week. Amy and I are going to go volunteer again this week and we want to volunteer on a more regular and a more frequent basis. But we can tell you that you're asked to wash your hands when you get there. You wear gloves. You keep 6 feet apart from the other volunteers. And so they do a good job of keeping you safe and keeping the people who depend on your help safe, while facilitating your ability to help those who are in need right now. And so if you can volunteer at the food bank, volunteer at the food bank. If you can't volunteer, or you shouldn't because you're older or you have an underlying condition that might make coronavirus or COVID-19 fatal for you, and if you have the means, make a financial contribution to your local food bank. And I can tell you the one here in El Paso could really use the help. So those are some ideas on how to volunteer safely and make sure that you're doing the right thing at this critical moment.
I'm going to do it, but I'm going to go volunteer this week at the food bank.
Buy produce from local farmers, says Ms. Rocco. Agreed. And there's some restaurants here that are sourcing local produce. I think Tabla downtown is doing that. Our friend Gwen just picked up a box from Tabla with local produce. There are other restaurants, I don't know if any of the grocery stores are doing that, but I like that. That's a great idea. A lot of restaurants are also selling off their inventory that they can't use anymore. I know Artavino's Desert Crossing in Sunland Park, New Mexico was doing that. We had some friends who went out and bought some meat from their freezer and also picked up some bottles of alcohol from their bar. And there you go. Okay, is that it, Kano?
I think that's it. That's it.
Okay, everyone be safe, stay at home, be good to one another, and join us tomorrow when we're going to have our friend Gina from Las Vegas. Join us Thursday when we have Jim Ward and mystery guests on Friday. We'll see you guys. Same time, by the way, 4:30 p.m. Mountain Standard Time. That is 5:30 Central, 6:30 Eastern, 3:30 Pacific. Same time every day.
All right.
And somebody just remind us, sorry, last thing, and then I'm done. Our good buddy Storm in Ohio says today is Trans Day of Visibility. So for all those who've been working for and sacrificing for trans rights, thank you for your work. And Storm, thank you for making sure that we said that right now. Adios. Bye-bye.